We have Dr. Warren on the show, and he is a lung health specialist. Dr. Warren, why don't you tell us a little bit about yourself before we get into the questions?
Yeah, absolutely. Thank you so much for having me again. It's really an honor to be here and to talk about such an important topic as lung health.
Absolutely.
I'm a thoracic surgeon. I specialize in surgery of the lungs, also lung transplantation, working at Houston Methodist. I am actually new to the Houston area. I just moved a few weeks ago. I was living in Baltimore for my training.
Wow.
I'm very excited to be here. And
welcome to
Texas.
Houston.
Yeah.
Texas.
Handling the heat, so the cooler weather today is definitely a relief.
I bet when you got off the plane, you were like, "Who turned on the heat? Like, what's going on?"
It was, I could feel the heat in the air, the humidity for sure.
Yeah, it just kind of slaps you in the face.
Absolutely, which is important to what we're talking about today with air quality and things.
Absolutely.
And it definitely was a shock when I first got here to feel all the heat.
Yeah. Well, welcome.
Thank you. I'm glad to be here.
So, should we just get right into the questions?
Sure. Happy to discuss.
Okay. So, with Lung Cancer Awareness Month coming up in November, could you touch on what people need to be aware of when it comes to lung cancer and lung health?
Yeah, absolutely. I think lung cancer is something that is not often discussed as much as some of the other cancers we hear about, like breast cancer or colon cancer, where the screening is more ubiquitous and people know about that. But lung cancer is actually the leading cancer killer in America, and it's something that people really need to know about. And November, Lung Cancer Awareness Month, is a great time to review what people need to know about lung cancer. And a lot of lung cancer awareness ties into lung health, which we'll talk about today, which is important. But
yes.
I think some of the take-homes to remember are screening for those who need screening, and those are generally something you can speak to your doctor about, see if you need screening.
And how often would you recommend the screenings?
Yeah. That's a great question. There's guidelines now that recommend screening in certain people.
Okay.
Generally, it's high-risk individuals, those over 65, with extensive smoking history or who previously smoked but smoked for a long time. And the specifics of who recommends, I think, speak to your doctor, and they can definitely decide, I think screening is good for you or not. And screening is relatively simple. It's one CT scan, a low-dose CT scan, not a big elaborate scan you need to spend a whole day getting, just a quick scan that can help identify maybe potential lung cancer.
Okay.
I think it's a really important topic because lung cancer is one of those diseases where you may not know you have until it's spread or it's more advanced. And many people are asymptomatic, meaning they don't know that they have cancer for a long time. Yeah. So being aware to look out for the signs or think about screening is really important.
Yeah. So, like now, young kids especially, they've gone into vaping and hookah bars are opening up everywhere. So what does vaping have the same what's the word I'm looking for?
The same risk or effect on the lungs and cancer. Yeah,
yes.
I think it's a really good question. And this is something, to be honest, I don't think we really know entirely yet.
Okay.
We do know that smoking is bad.
Right.
Traditional smoking with cigarettes, and I think that's something that most people now know. And we have working really hard to help people quit smoking if they're smoking or not start smoking if they haven't. And I think all that still applies. But when it comes to vaping, we really don't know the effect.
Okay.
I think vaping, most devices use chemicals to deliver whatever you're getting in the vape device, and those chemicals can potentially be carcinogenic, meaning cancer-causing, or just damaging to the lungs.
Yeah.
And we don't quite know. There are people that reported having serious pneumonias or infections and other lung diseases because of vaping. So it is a serious problem, and it is something that anytime you're inhaling a smoke or something in your lungs, it's probably not a good idea. And we recommend against, I think it's as a general consensus, recommend against vaping. But the true negative effects, still don't really know yet.
Okay.
Yeah.
Okay, well, that's good to know.
Yeah.
And how does the healthcare system in Houston help support lung health? Actually, you know what? I'm going to ask that later.
Yeah, okay.
I'm going to ask that last. So how does the air quality affect lung health, and what measures can individuals take to protect themselves?
Yeah, now that's a really good question. I think that's something I'm learning a lot about in Houston, too, because each area has their own things you need to be aware of about the air quality.
Yes.
And, different factors that may affect that. In general, when we talk about air quality, we're talking about things that are in the air that could potentially damage your lungs when inhaled. Things like particulate matter, could be dust or soot. There could also be chemicals released from factories.
Yeah.
In Houston, there's oil refineries and different factories surrounding Houston, and those are definitely potential sources for chemicals that could be released into the air. Also things from burning of wood, ash, and even from weather, from chemicals that are raining down. And all these things, when we talk about air quality, they can, as you breathe them in, they can damage your lungs in many different ways. Some people can have irritation from the chemicals right away, and they can have coughing or other symptoms, worsening of allergies, things like that. But a serious issue is that sometimes it can cause chronic problems, because when you inhale chemicals, you get inflammation in your lungs that over time will damage your lungs and could lead to conditions like asthma, COPD, or lung cancer. So it's something that people need to be aware of, and there are a few ways to help protect yourself and become aware of. Number one is to know it's always published what the air quality is, and in Houston you can use several websites to find out what is the air quality today or what's it been like. And for some people it may be necessary, if the air quality is particularly bad on a certain day, to avoid going outside as much, or wear a mask if there's something that's for people with asthma or COPD or some kind of chronic lung disease. Just things to be aware of. In Houston, the air quality actually has been improving, which is great news. We use something called an AQI, the Air Quality Index, which is a marker of how polluted the air is, how much toxins are in the air, and the number has gotten better and better over the past 10 years. It's still in the moderate range, meaning there's a moderate level, and it does fluctuate week to week, day to day. So, and that's something you can keep an eye on and say, okay, today it's a little. The AQI is higher than it's been. Maybe I should stay inside a little more, or if I have asthma or some other condition, be extra careful outside. And that's something you can get quickly online or on an app on your phone that will tell you each morning
how the air quality is. Okay, I think that is important.
I think there's some other things you can do. In your home, you can use air purifiers or things like those. There are certain things with HEPA filters, which are actually designed to remove those particulate matter from the air.
Right.
And and just being aware of what's going on.
Yeah, I know, because both my husband and my youngest one have really severe. My husband has severe allergies. My little one is starting to get allergies. She definitely has allergies to air pollutants and things like that. And so when we built our home, we made sure that we did the humidifier, the UV, the all the clean air duct cleaning that goes inside.
The thick filter for
So it definitely does help the quality of the air in the house. But then when you go outside, then you're again exposed to all of that. So
there's unfortunately there's no way to avoid it in some senses. You got to go outside and you got to participate. But maybe if your child has asthma or is getting bad allergies, and you could say, okay, maybe today we don't play outside, we don't run around outside. We can go outside, but we're not going to exert ourselves outside, or those type of things. Just to adjust.
There's always options.
Exactly.
Okay. So what roles... No, actually, you know what? We do continue to hear about global warming, and it has many aspects of our lives and health. Does climate change have any effect on lung health?
Yeah, that's a great question, and that ties directly into air quality. And I think you're right. We hear a lot about global warming and the temperature change. I think we definitely know. We can sense that it's been hot recently, and how does that affect our lungs? Well, in general, when there's global warming or when the temperature's going up, you can see increases in pollution and chemicals in the air from burning. You hear about wildfires and things like that. Those all release chemicals into the air. And it's really important that we work together to try to minimize all that pollution that's a result of global warming. Other things with global warming, another pollutant I didn't mention yet is something called, you might hear of ozone. There used to be concerns about them in bottles and things, and the ozone layer is a significant protectant from global warming, and as it's being destroyed, it's getting released into the air, and that can also damage your lungs when inhaled for a long time. So, all these things kind of tie together. But the good news is, like I said, in Houston particularly, we've seen that the quality...
I'm glad you said the good news is. Because I'm over here in panic mode.
Well, I'd say the good news is we've seen some progress. So there's been a lot of policy changes and other activist groups that have tried to promote better air in Houston in particular. And we've seen improvements, so we can keep it up. There is a lot of work to do.
Absolutely.
But I think it's really important that we think not just about global warming as, it's hot, but what is the impact on our bodies and also our lungs?
We need
one
them.
of my focus that I think about, and we definitely need our lungs. And as the air gets hotter, we're going to be more susceptible to toxins in the air. Exactly.
Yeah. Wow.
Actually, I have a question.
Yeah, of
Since
course.
you said about a quality index, it just struck me that when I would check the weather app,
Yeah.
it said at the
Yes.
bottom air quality index, and I was always wonder what it meant.
Oh.
Yeah.
Now we can, but does that change every now and then, or does it change every day?
Yeah.
I'm sure it would change every day.
Yeah,
no?
most apps will change it every day. They give an estimate. The Weather Service will give an estimate of what the air quality index is that day or the past 24 hours. And I don't know that the specific number, really, it went up 1 or down by 5. But you could look at the general, and it'll tell you today's in the moderate range, or this is what it usually is today.
Right.
But it might say this is much higher than it's been the past week.
So
And
it does give you a range as
Yeah,
well, that
yeah.
it's been less and it's been more than what it used to be before. Because I have checked Victoria and Houston
Yeah.
and Richmond, and it gives different numbers. I
Oh,
always wonder what that was, but now
Yeah.
it so much makes sense.
yeah,
that's so cool. I'll look for that now.
Yeah, it's. I think it's something once you notice, you could start to keep an eye on it. And you could say, or you might notice, wow, today my allergies, or I felt a little, I had a little cough today, and you could say, wow, it's
It's probably
the air index
That
was not
makes
as
so
good
much
today.
sense.
So you could notice those things, and as you do that, you can look proactively and say, today's it's showing that it's a little higher. It's in the red. It's usually in the yellow or the green, and I should be a little more careful.
That is crazy because my daughters, my mom and them have a dog, and my little one has allergies. When she's around him a little bit, it's okay, but throughout the whole day, it gets bad. So she's been like saying that, my nose is stuffy, and I'm just like, you're fine. Like it's probably just in the air or something, or it's the dog, or I don't know. But that makes so much. Okay, so I'm going to start looking at the
Yeah.
air quality.
the air quality index. Yeah.
It's really interesting to track it because it's you don't always notice it, but it could be a shift where the winds change, and
Yeah.
again, if there's an area where there's a factory or oil refinery and it's shifting the winds and bringing the dust towards Houston, you might notice over this week the air feels a little stuffier, things like
Yeah.
that. So yeah, and again, those might be times to be a little more cautious.
Yeah. Wow. We never look at those
More
things.
than the weather, we're going to take
Exactly.
Yeah.
Can't go outside. Wear a mask.
It's very unfortunate, but it's something that we do have to do now. I
Yeah.
think, to protect ourselves.
Wow. So, what roles does exercise play in maintaining healthy lungs, and are there specific activities that you recommend?
Yeah, that's a really great question. I think one thing I will definitely want to advocate is everyone try to keep their lungs as healthy as they can, keep
Yeah.
their bodies healthy, and exercise plays a critical role. I think we know that exercise is important, but how does it really affect your lungs is something people don't really talk about, I think. We think
Yeah.
our heart, but our heart and
Yeah.
lungs are really connected. It's one system, and as you exercise, you're not only benefiting your heart, you're benefiting your lungs.
Yeah.
When you exercise, it triggers, especially aerobic exercise, where you're kind of working harder, your heart's beating a little faster. That's when the heart and lungs are working in sync to try to give oxygen to your body.
Right.
And the more exercise you do, the more trained your lungs become to deliver that oxygen. Exercise has numerous benefits. It can help build your lung capacity. Actually, the amount of air you can breathe gets higher, which gives you, again, more oxygen to your body. It works in conjunction with your heart to deliver oxygen, and it also can strengthen the muscles of your chest and your breathing muscles. So
Wow.
breathing actually becomes easier as you exercise. And I think that's very important for many reasons. For most people, you don't notice, you're breathing while you're breathing. But
Yeah.
when you become sick or when you're exerting yourself,
Yeah,
you may want
you
that
feel
extra
that, yeah.
reserve, that extra strength in your muscles and your chest and your lungs. And that's
Yeah.
really what exercise can bring.
Wow. We don't think about these things at all.
Yeah, and it's I think breathing and your lungs, I think unfortunately something you just kind of take you don't notice it much,
granted.
right? Until
True.
there's a problem. And
Yeah.
even people with lung disease, I think it's important to say exercise can still, definitely can help them too to lessen the disease or help them with their symptoms. Obviously, I think it's important to say that if you have a lung disease and you're going to start exercising something, talk to your doctor.
Yeah.
Make sure that you don't want to just jump in and run a marathon. You want to make sure that it's a safe exercise program to build your
Right.
strength. But people with asthma, COPD, exercise, walking and running can definitely help strengthen your lungs. I think exercises that are probably the most beneficial are things, again, aerobic exercises like walking, for long enough to get your heart rate up, running,
Yeah.
swimming. Biking, those are great exercises.
Yes,
Not that anything can be helpful, but that's
Yeah.
really when your lungs start working. Is
Yeah.
when you're breathing a little harder, and I think that's a normal process when you're exercising. That's
Right.
when you're getting the strength. And I think, the current recommendation I'd say for lung health, and this is down to the American standard right now, is 30 minutes, 5 days a week of some kind of aerobic exercise.
Okay.
That's a goal I think is.
Yeah.
It's a scale. Everyone has their own way they can approach that.
Yeah.
I think for some people that's a lot. Some people that doesn't seem like a lot. But I think you could start tackling it step by step and say, I'm
Yeah.
going to do something today, or I'm going to
Yeah.
do something, and make smaller goals and build up to that.
Yeah, start 10 minutes a day and then
Yeah.
work your way up.
Exactly. And if you want to do 30 minutes, say, okay, I'm going to walk for 20 minutes, but I'm going to try to push myself a little bit for those last 10
Yeah.
minutes. And then eventually you notice, wow, the whole 30 minutes I can do a little more.
Yeah.
I think that's really important for lung health. Absolutely.
So you said there were patients that were asymptomatic, and then there are patients that would actually feel like that there's something wrong with their lungs. Are there, like, what are the symptoms that they would?
Yeah, great question. Lung disease, there's many different types of lung diseases that there are,
Right.
and I think in some ways they all have different symptoms, but a lot of times the symptoms are very common, and that's why if you think you might have symptoms of lung disease, it's important to talk to a doctor because they can all present very similarly.
Okay.
And it's hard to tell what
Right.
disease or what's causing your lung issues. Most people, when they have some kind of chronic lung problem, cough is very common. You can have a dry cough or some kind of productive cough with mucus. A little shortness of breath you didn't notice before that's getting worse or progressing, especially when you exert yourself. I think
Yeah.
everyone says, well, I would get a little short of breath. Well, when you're exerting yourself really hard, you might get a little short of breath, but that
Yeah.
should get better when you rest right away. But if you notice your short of breath getting worse, or you have chest pain or cough while you're doing that, that's definitely something to bring up to your doctor and say, this is something I've been experiencing.
Okay.
Yeah.
Okay. So what advancements have been in the treatment of chronic lung disease, such as asthma or COPD?
Yeah. That's a great question. I think and I think lung disease, again, and lung health, people don't really think about till you have a problem, and oh, well, lung disease, there's not much we can do for many things. But actually, it's been a very exciting time. In the past 10, 20, 30 years, there's been many new treatments available for people with chronic lung disease, especially in the early stages to help prevent it from getting worse, which is, again, why it's so important to think about your lungs health and think about talking to your doctor about your lungs and if you've developed symptoms you're concerned about. Certain conditions we think about, like asthma, many of the traditional treatments that people used to take, like inhalers and steroids, those things still work and we still use those, but there's actually some really interesting and exciting new therapies called biologic therapies that actually use your own body's immune system to help regulate the asthma or the COPD.
Oh.
It's really exciting. That's kind of come about pretty recently, and so people who have had really depend on their inhaler for a long time can finally get some relief.
Really?
Of medicine. So I think, again, if you have, I think just to say that, make sure, people, I have asthma, there's nothing I can do, but talking to your doctor regularly and following up is really important to see what new options there are.
Yeah. Oh, that's pretty cool.
Yeah.
Okay.
Things like COPD too.
Yeah.
I think that's another common disease we see, especially older people as they get older, or people that have smoked, bronchitis. You might hear bronchitis. And there are new treatments for that as well. One of the things that I do is surgery for some of these advanced lung diseases, and we've seen a lot of advancements in that as well. There's a procedure for COPD called lung volume reduction that we do that actually we're able to do minimally invasively now without big operation, just with a camera. And,
oh, wow.
And, so that's really exciting option for people.
Yeah.
And I think one other thing I do is lung transplant, which is something that's on the very far end of people with lung diseases, and something nobody's like, oh, I want a lung transplant. But it's something that I'm excited to say is available for more people now.
Cool.
And it's getting better, and it's getting safer, and people are living longer with it, which is a really important option for people with advanced lung disease. And in Houston, there's great centers to,
That's pretty cool.
Yeah.
There's lots of different programs out there or options out there for
exactly
patients.
Yeah. So I think it's important for people who either have early stage lung disease or advanced lung disease just to keep following up and make sure they're checked in regularly and know what options are there.
Yeah. So like there's a lot of on the radio, especially every morning I listen to this show, and they always talk about there's this body scans that are available now that will tell you like what kind of diseases that are within, because there are people, like you said, that are asymptomatic and you just don't know.
Yeah.
But there are scans that you can do that will actually tell you, okay, you have this and this and this, and they can even detect cancers.
Yes.
So I thought that was pretty cool.
Yeah, that is really exciting. I think, the scans are getting quicker,
Yeah.
easier, cheaper, and I think that's allowing them to be more accessible to people. I would just say, you have to be careful because we don't always know
Yeah.
this is a new thing, and we don't know what all the information you get from that means.
Yeah.
What I mean by that is sometimes they find things that may or may not be important, or may
Yeah.
be something that would it have been a problem? Maybe, but now we see it, so
Yeah.
let's do something about it, and we don't always know the right answer there.
Yeah.
I think there are guidelines, especially in the lungs. There are guidelines for who should definitely get a screening scan.
Yeah.
And I think that's why it's talk to if you're thinking about doing a body scan or something. I'm not saying that it's right or wrong, but
Right.
talk to your doctor.
Talk
Say,
to
is
your
this something you think I need?
Yeah.
Do you think they recommend? And they may say, based on our best evidence right now, you don't need this for your lungs. If you want it for another reason, you should. Or if it'll make you, if it'll make you feel better, you should pursue it. I think there's something to be said for that. But a lot of the screening guidelines are based on trying to balance over detection and under detection.
Yeah.
Making sure we don't miss people with cancer, but we don't need to send everyone to get the scan each day. Right?
Yeah.
You need to find the right balance, and that's
True.
where they come up with these guidelines over many years.
Yeah.
And but yeah, I think it's something that there's options are becoming available, and it's something to
Yeah.
think about, especially for certain people who are I need to know what's going on. I want to be
Yeah.
on top of it, and that might be right for certain people.
Yeah.
So talk to your doctor.
But I like that. Talk to your doctor first,
Yeah.
always. Yeah.
Absolutely.
Yeah. So how important is early detection in lung disease, and what do you recommend for the risk population?
Yeah, I think
at-risk population.
Yeah, I think we started talking about that. It's a great point. And for many of these conditions, like I said, you don't know you have them until they're kind of advanced, right?
Yeah.
Sometimes you might notice a subtle cough or things, but many people, especially lung cancer or early bronchitis, they might not notice many things. So again, talking to your doctor early and just following up and say, every time you see them, hey, what's going on in my lungs? Is there something I should be worried about here, or anything I need to be doing? And I'm exercising, I'm doing those type of things. So for lung cancer in particular, like I said, early detection is critical, and that's something we're really pushing hard now. I think they keep statistics and on who's getting screened appropriately, and I know Houston there's still work to do. Not everyone that needs screening is getting it yet.
Yes.
And I think keeping the awareness out there, there are many places you can get screened for lung cancer if you meet the criteria.
Okay.
So talk to your doctor and see if that's something that you should think about. Other diseases like asthma and COPD, or there's some other diseases called pulmonary fibrosis, which is another lung disease that can progress if you don't start early medication. So these are things that you really should, again, just talking to your doctor and following up early is really important to think about. Yeah.
Okay. So, can you discuss the significance of vaccinations, like a shot for pneumonia or the pneumonia vaccine?
Yeah, I'm really glad you brought that up. I think a lot of we're talking about lung health is preventative.
Yeah.
We're talking about avoiding toxins in the air and exercising, and vaccines are a critical component. Again, people don't think, well, I'm getting vaccinated, I'm just preventing illness, but I'm not protecting my lungs. But many, if not all, of these vaccines are really diseases that either start in the lung or spread through the lungs or infect the lungs. Flu, COVID, pneumonia vaccines. Those are all lung diseases, really.
Yeah.
So it's really important
That's
for lung
true,
health. And again, this is another area I know. I was just reading about this before. In Texas, I think last year, I want to check, only about 40% of people who were eligible for the flu vaccine got it.
Oh.
So there's still a lot of work to do to get people vaccinated timely. Many of these conditions, the vaccines can help prevent the illness, but they can also decrease the symptoms, and we know that, and decrease the long-term effects. Things like the flu can actually cause long-term damage to your lungs if you get the flu. Many people don't have that. Many people get the flu and they feel crummy for a few days and they have a cough or they have a fever, but then they get better. But some people can linger. We've seen that with COVID too.
Yeah.
And these vaccines can hopefully prevent those long-term complications. The other thing to think about vaccines, especially important to those who already have lung disease, because if you already have a lung disease like asthma or COPD or pulmonary fibrosis, those illnesses can be especially challenging for
Yeah.
you and cause problems. So really being on top of vaccines for those people. Even if you don't have a chronic illness, my lungs are fine, why do I need these vaccines? I'd say, you're also helping those people too, because again, they're spread through, most of these diseases are spread through respiratory, droplets or cough or things like that. So by getting vaccinated and minimizing the time you get an illness, you can help prevent spreading it to other people, which is very important in protecting everyone's lung health.
Yeah.
So
absolutely.
Vaccination is critical.
I mean, we had the flu to worry about before, and now we have COVID. And just, I know, like, I have had a couple of family members that passed away from COVID. Yeah, unfortunately. And when my mom got COVID, it was quite bad. And I know that for her, the recovery was really bad. Even now, like, she went from 135, 40 pounds to 100 pounds now. And still she's dealing with, the repercussions of what COVID did to her. So, I mean, as sad as it is, I mean, I always tell everyone, just get vaccinated and save yourself, save the people around you, the people that you love, and it's important.
Yeah, we hear a lot about, things are changing, guidelines are changing, but I think, being aware, should I be getting vaccinated? Should I talk to someone? Just keep asking questions about it so that you can know. You can stay ahead of it and make sure you're getting it when you need to. Yeah,
absolutely. We're going to take a real quick break, and when we come back, we will continue our conversation with Dr. Warren. You're listening to 103.5 Hum FM. Welcome back to Chai Time here on 103.5 Hum FM. We are in conversation with Dr. Warren on lung health. So, Dr. Warren, what are the dietary choices and what dietary choices influence lung function and respiratory health?
Yeah, that's another great aspect of lung health that people don't really think about is the connection between food and your lungs. And, so we know that the lungs actually, what we were just talking about, are exposed to a lot of toxins and things throughout the pollutants through the air.
Yeah.
And they're one of our main sources of protection from pollutants and poor air quality. But because of that, they can get a lot of damage and they get a lot of inflammation. Yeah. So part of what our diet can do is help to minimize that inflammation, help our body heal the lung tissue. And I think diets high in anti-inflammatory things like antioxidants that can help, promote healing. Things like obviously fruits, vegetables, certain vegetables that are really high in spinach, nuts, those type of things can really help promote healing in the lungs and reduce inflammation. Just having a very balanced, healthy diet is very important for lung health. There's certain things probably we don't know specifically for the lungs, but can avoid to can promote health in general and for the lungs. Things like processed foods, which can be higher in carcinogens or other toxins that again will slow the healing of the lung and. Sugar, the more sugar.
That's my weakness.
We all love sugar, but sugar again, in order for the lungs to work effectively, to process oxygen and to be able to heal and deal with toxins, the sugar levels need to be balanced. And for most people, that's not an issue, but especially if you have diabetes or you're pre-diabetic, it's something to think about. You don't think, if my sugar goes high, it's going to hurt my lungs, but it can. It all works together, your heart, your lungs, and the whole system. So you have to keep that in mind. I think again, a balanced diet.
Yeah, leafy green veggies and good handful of fruits and berries and all of that good stuff, right?
The other thing that people talk about with lung health is good fats that can help reduce inflammation, like omega-3s from fish and other nuts, things like that. That can also really, those things can.
What do you think about MCT oil?
Yeah, I think again, this is something we don't quite know enough yet about. There are reports that it can help. For general inflammation, things like that. But I don't think I'm not aware of it specifically in the lungs benefit. But I think these are all things that probably in a balanced way. At least having nutritional supplements can be beneficial. I think talk to your doctor and say, if I use this in conjunction with other things in a healthy diet, would this be beneficial? And talk to them about that for sure.
Okay. I take it like the way that you're talking about food, I take it as like, how when we put like filters in our air conditioner or our AC units to get filtration from all the pollutants is the same thing with your foods as we eat them. It's filtering all the bad stuff out. And that's how I'm imagining it.
Yeah, and it's allowing your lungs, which act like a filter, to be optimized. You have to change the filter and keep maintaining it and If you just kind of put the filter in a corner and let it
It's not gonna
sit,
work.
it's not going to work. But you have to keep the body healthy too, so the filter can work appropriately. Exactly.
Yeah.
And I think a healthy diet and exercise, two of those really can help do that
Really
for
help.
sure.
Okay.
Yeah.
Now, so how do occupational exposures affect lung health, and what precautions should workers in high risk industries take?
Yeah, that's a great question. Again, especially in Houston, I think there are a lot of different varied industries, but definitely some manufacturing or chemical industries, oil, all those type of jobs can put healthcare workers to there's many different jobs that can put you at risk for exposure to different toxins, and I think that's a risk that many of us take that is necessary, but it can be mitigated safely. I think that's something you have to bring awareness to it so that you can know. And if you're working in an environment like that, making sure you're using the correct protective equipment. You might hear the term PPE, personal protective equipment. People in different jobs, they might talk about that, and you may say, "Oh, my employer says I got to use this mask or I got to wear this." But those things are designed to keep you safe, and it's really important to do that to make sure that your lungs are not getting any of those toxins that might be released. And talking to your work, you say, "Hey, I was wondering, there's this. Is this something I'm at risk for here, or do I, And there is a body that watches every job to make sure. It's called OSHA, to make sure that the health and the air at these jobs is safe. And companies and employers should be following those rules. And if you have any concerns, you should bring it up to make sure. Hey, I want to make sure I'm safe at this job and doing what I can to protect myself. I think it's important for everyone to know about them too, because these occupational exposures can unfortunately affect us too, right? If there's a factory nearby, it can release things nearby. So you have to just be aware of what's in your environment and do what you can to protect yourself.
Yeah, absolutely. What advice would you give to someone looking to improve their lung health through lifestyle changes?
Yeah, that's a great question. We talked a lot about different things, aspects of lung health, from diet and things, and all these come together to what can you do?
Yeah.
I think kind of highlighting some of the things we talked about. Working on exercise is really important. We talked about 30 minutes, 5 days a week. For some aerobic exercise. Get your heart going, get your breathing a little faster. These things can really help build lung health. Optimizing your diet the best you can. Just to mix in some more antioxidants or anti-inflammatory things through omega-3 fats or leafy greens, like you said. Absolutely, those things can be very beneficial. Trying your best to minimize sugar. We all. I'm beyond guilty. my wife knows I'm a candy fiend. I can't get away from it. So, but you just try your best to to balance things out. And other things, using protective equipment, like we said, when it's necessary. Especially if you're following the weather and you think, okay, today I need to be extra careful. Using filters in your home, using purifiers additionally if needed, or on bad days. I think the other thing, exercise-wise, I would talk about is breathing exercises. People don't, we always talk about breathing exercises for relaxation, but they actually can benefit your lungs too. When you take deep breaths or big sighs, it can help expand your lungs. So taking time to relax and take deep breaths, working on what some people call diaphragmatic breathing, where you really take a big deep breath, can help promote lung health. The other thing I would say that I think we were going to talk about is sleep.
Yes.
Sleep. I don't know. People don't think about sleep again with with lungs, but it's critical to appropriate sleep. Again, your lungs, like the rest of your body, need to rest and heal, and sleep allows for that. So good, getting the recommended amount of sleep each night. And there's one specific condition that people may have heard of called sleep apnea, which is a condition where you actually don't breathe. You stop breathing temporarily while you sleep. People often associate with deep snoring, things like that. And people, for that treatment, they might wear a mask at night to help promote airflow into the lungs. And believe it or not, I think people think about this just as, my tongue, or I can't breathe well. But actually, over time, this causes damage to your lung, particularly the lung and the blood vessels in the lungs. So if you are a sleeper, if you are a heavy snorer, or you notice yourself waking up not breathing, or your partner, a lot of times your partner will say, hey, I noticed looks like you stop breathing every now and then in your sleep, or your snoring is really, really deep. Something to talk to your doctor about. Because there are treatments for it, and it's something that over time will affect your lung health. For
Yeah.
sure, it can cause damage to your lungs.
It's crazy. I would never have thought that sleep apnea would have such a big
Yeah.
effect on your lungs.
Sleep apnea affects a lot. It's a
Yeah.
big problem that people don't realize, but it's something that we have good treatment for now.
Yeah.
And there's masks, and the masks are getting smaller and less noisy, and there's
Yeah.
other treatments too. So these are things that you definitely need
That
to
are,
think about.
yeah, that are available, yeah.
The other thing I'd say for promoting lung health, especially in the heat here, we talked about
Yeah.
global warming, staying hydrated.
Yeah.
The lung, it's a very moist environment. You feel the mucus and things, but it needs actually that mucus to keep. That's part of how it absorbs the toxins and keeps things clean, like a filter. So you need to stay hydrated, and actually, hydration is very important for the lungs. And so again, when you're exercising, then make sure you're staying hydrated, especially when you're out in the heat.
Yeah. Oh wow, that's one thing that I'm very guilty of, is not drinking enough water and
me
having
too.
too much sugar. But we're not going to talk about that.
Me too. Yeah, if you're drinking water, I always feel like I'm running around. I always forget, but now I'm trying to be conscious to keep like a bottle. Okay, I'm going
Yeah.
to drink this morning. I'm going to finish this. Just
Yeah.
so I stay on top of it.
Yeah. Set yourself reminders like Alicia does. She has like reminders for everything on her phone.
yeah.
Like an alarm will go off, like, okay, time to drink water. Or like,
I need you to show me your technique because I'm forgetting about a lot. So.
Reminders.
it's just reminders. So I do have a quick question. Are there specific symptoms that one should seek medical attention regarding their lung health?
Yeah, that's a great question. I think we talked about some of these, but we haven't really kind of gone over all of them. And I think you should be aware that many of these things are come and go. But most of the time, if you notice it's recurring or it's getting worse, that's definitely time to talk to your doctor.
Yeah.
Things like a cough, shortness of breath, difficulty when you're exercising that you notice you're more short of breath, chest pain. If your cough changes, we get sick and we cough, and you might notice, it's a little more mucusy or green. That happens obviously when you're sick. But if it doesn't get better, or if it's getting worse, if you notice blood in your cough, if you're cough up some blood, those are signs you should talk to your doctor.
Yeah.
Doesn't necessarily mean there's something wrong, but it unfortunately can be a sign of something like a lung cancer or a chronic lung disease. So those are times where you definitely should speak to your doctor and say, hey, I've noticed this going on.
Okay. Oh, wow. When you were talking about breathing exercises, I realized that anytime you go to the hospital and you've had a surgery or anything like that, they'll always give you this, breathing tube thing.
Yes.
Right? Is that to clear the airways?
That thing is amazing. Yes, I'm glad you noticed it. Because we actually try really hard to promote that as a thing. It's always sitting there on the side of the bed, and nobody knows what to do with it. Absolutely. That thing. It's called an incentive spirometer. And what it does is it's basically an exercise machine for your lungs. So it helps you practice taking deep breaths, those diaphragmatic breaths. Each time you do that, you expand your lungs. You help build the reserve. Your lungs they're kind of like sponges wrapped in saran wrap.
Yeah.
And they kind of, like a sponge, they can shrink and they can get bigger and swell. And if they're not used, they kind of shrink down.
Yeah.
So the more you can exercise them, they start to get bigger and bigger and bigger. So especially
and I do think those things work, actually.
Oh, absolutely.
They work amazingly because, and I'll tell you a story. Hannah, my little one, she, when she was little, she had to always have the nebulizer.
Yeah.
And so the doctor said she might develop asthma as she gets older, and I was like, no, she's not, because Mama Bear comes out, and I actually bought that thing on Amazon for her, a little baby one, and she would use that all the time, and I would always make her use that. Anyways, long story short, she's fine.
No,
she didn't have
amazing.
to ever have the inhaler or anything like that.
That's great news. Yeah, I think that's something that everyone can, even if you're healthy or especially people with chronic lung disease, they can actually continue to use that thing to practice building their lung strength. Yeah. It has, the other thing it helps do is helps clear your secretions, like you were saying, because as you take those deep breaths, you can cough, bigger coughs, and get that mucus out, which is, I can't speak highly enough about those things.
Yeah, I love those things.
That's another way you can, I'm glad you noticed, because everybody in the hospital, every patient I say, this is your best friend.
Yeah,
you can't,
use it.
You can't do too much. I tell people if they're staying at home watching TV, just every time there's a commercial, just grab this thing and take some breaths, take some deep breaths and practice.
Yeah. It's pretty cool. It's a cool tool.
Yeah.
So how does mental health impact respiratory health, and what resources are available for patients struggling with both?
Yeah, that's a great question. Another aspect of things that, again, it's all connected. We don't really think about our lungs and our mental health, but really, you may notice a lot of times people, when they stressed or anxious, they notice, oh, I'm having trouble breathing, or I'm short of breath.
Yeah.
And so they're really interlinked, especially other people who have asthma or COPD. They may notice, well, when I'm stressed, it's worse. I can notice.
Yeah.
And it's kind of, unfortunately, can be a cycle, because you might either be, you get short of breath, and it makes you anxious. And when you get anxious, you get more short of breath.
Yeah.
So a lot of that is, again, working on your mental health and your stress to try to keep that minimized.
Yeah.
And it can help promote lung function and your lung health.
Yeah.
So, talking to your physician, and if you have a mental health counselor or somebody to talk about, hey, I'm worried about my lung health, and I'm worried about my anxiety affecting my breathing or my stress. Those are all things that you can talk about to do that. So I think, again, it's a really important part of lung health, is keeping your mental health.
Okay. Now, my last question for you is, one advice that you could give to the people that are listening today, what advice would that be?
Yeah, absolutely. Number one, definitely be, if you're smoking, try and stop smoking. That's the most important thing you can do for your lungs. That, unfortunately, is a toxin directly to your lungs every day.
Yeah.
And I know from spoken to many people that it's very tough to quit smoking, but there are new resources. So it's something that, even if you tried before, you should keep revisiting, because there's new medications, there's new resources to help people quit. If you're not smoking, don't start smoking. That also includes things like vaping or other new devices. Just stay away from it as much as you can.
Yeah.
That's the number one rule. The other thing I'd say is, keep up your exercise, and just keep an eye on your lungs. Think about them like you think about other parts of your body. You keep healthy. Talking to your doctor specifically. People ask, oh, I'm worried about my heart, I'm worried about these things, but say, what can I be doing for my lungs?
Yeah.
My doctor, each time you go.
Yeah. Okay. Wow. This was a very great show, and I mean, we've learned so much just within the last hour that we've been on the show with you. So thank you so much.
Do you have another question that you said you're going to ask in the end about something about Houston, or was it this one, the advice?
Oh, the resources.
Yes, I did actually. Yes. So, how does the healthcare system in Houston help support lung health and those with lung disease? Are there any community resources? Thank you.
That's a great question. The American Lung Association, which is kind of a governing body, medical body that oversees lung health, it deals with environmental pollution, also people with chronic disease. But they have these support groups.
Okay.
They're called. It's called the Better Breathing Club. There's one in Houston.
Oh, Better Breathing Club.
Better Breathing Club, and they do several things. They can help people promote the advocacy for environmental health and keeping the air clean. They also have support groups for people with chronic lung disease to meet and talk about their illness.
Wow.
Online forums, things like that. I think they meet monthly, so it might be something if you have chronic lung disease or you want to learn more, it might be interesting to look up better.
It's like a support group.
Okay. Support group in the area, and advocacy group, the Better Breathing Club. I think there's also a lot of, especially with the medical center here, there's a lot of different support groups for each individual lung disease, like cancer and emphysema or bronchitis, asthma, and look into those things. So I think there's plenty of resources here to investigate.
That's cool.
People with these diseases are not alone. A lot of these people have these diseases. So it can be really helpful to speak to someone else who may be going through something very similar and said, I tried that medicine too, or I tried this breathing exercise, it helped me. Just try different things and see.
Having somebody there to talk to, I think that just makes a big difference, huge difference.
Yeah, and it can help your lungs. So
absolutely. Wow. Okay. I think that's the end of our questions. But no, thank you so much for coming on the show. I mean, we really appreciate you. And hopefully next time we can have you back on the show and talk a little bit more about lung health.
I'm happy to talk about it anytime.
Thank you so much. Thank you, Houston, for listening to us here on Chai Time on 103.5 Hum FM. And we will see you same time, same place next week. Thank you. Bye-bye.